Have you been feeling sad, down, or been getting less pleasure out of life?
I was driving around and heard an ad in the radio for a research program studying depression. And they read off all these symptoms, and I thought, I have a lot of those symptoms. Maybe I should call.
Florida resident Stephanie Medola was in Atlanta on business.
Emory University Department of Psychiatry is now conducting a large study of FDA-approved treatments for depression.
It was a radio advertisement.
Teacher James Dinsmore was on his way to work to spend another day educating students.
I dreaded to come to school.
Hiding his suffering. Both made the call to Emory Brain Health. And what happened for each of them is part of a decade-long, just-released NIH-funded study that could revolutionize the way depression is treated.
It's the idea that just like cancer or pneumonia, that you actually need to know the type of depression to treat it properly.
Neurologist Dr. Helen Mayberg led a team that enrolled 344 people who had never been treated for depression, each randomly assigned either talk therapy, cognitive behavioral therapy, or given one of two medications.
The first time you meet a patient, you got to make a decision, drug or therapy. Those are the first line treatments for every patient. How does someone decide?
Brain scans taken before the patient started treatment showed stunning predictive results. They confirmed findings of an earlier study that used PET scans, that scans done before treatment can predict which treatment is best and which should be avoided.
We also found a pattern, and this time involving 3 regions working together, that actually, again, if they're connected to one another in their activity, you do great on therapy, terrible on drug. But if they're unconnected, if they're not talking to each other, you need drug.
James received medicine and his depression went into remission.
I'm doing great. I'm doing much, much better today. Things are looking up everywhere.
Stephanie received cognitive behavioral therapy and has been free of depression for 7 years.
So this is a watercolor I did.
Creating art was part of her healing.
It's really exciting to know that we're treating depression like a disease and not just like a flaw in a human being.
I was just glad to be able to get help.
This is the beginning of a dynamic shift away from trial and error treatment of depression to one day an objective test to determine precision treatment. Study co-author Dr. Bodie Dunlop.
This is the major challenge in treating depression, is trying to get the right treatment right away.
You do great on therapy.
The study's results will need to be replicated before it can be put into practical use, but patients can be empowered now.
I think the message from this for the individual is that if your treatment's not working, then it's okay to ask your doctor or your therapist, is there an alternative that I can consider?
An epic discovery for the millions who suffer depression, the answer to what they truly need to get well, hidden until now. Jay Watson for Emory Brain Health.